Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
It's just very tight in the mid back section. Especially if I'm trying to play tennis or golf.
Twisting?
Yeah, the twisting
motion aggravated. Okay. So how long this been going on?
Gosh, probably on and off for about 20 years.
20 years. Do you remember any mechanism of injury or just happened?
No injury. Probably just more occupational hazard.
Okay. So for 20 years, how much pain do you feel from 0 to 10 at worst?
Probably the worst that's ever been, maybe about like a 6 or 7.
So for the last 20 years, what kind of treatment have you received for this?
Oh gosh, I've tried everything. I've tried physical therapy.
Okay.
I've tried acupuncture, massage, chiropractic.
Okay.
About the only thing I haven't done is surgery.
No
I don't want to do. I don't want to do any surgery.
Well, you have a muscle tightness, so we try to address it.
Okay.
Yeah. So you tried everything. Okay. You're very tight. Let's mark on your leg how much you can go. Touch your legs. So you're missing like quarter of your length there. Okay.
I could go farther, but it's
very tight. Very tight.
Yes.
Okay. Let's extend back. That's very stiff.
That's really tight.
0 to 10, how much?
It's about a 6.
6. Okay.
Yeah.
All right. So let's do twisting left and right. So range of motion twisting wise is okay, but you're very limited with extension. Very limited. Let's do side bend left and right.
That's probably worse than the twisting as far as mobility, I think.
Side bend?
Yeah.
So how much tightness from 0 to 10?
It's probably about a 5.
5, okay. And the mid back, yeah. And extension, how much?
About 3 or 4.
Okay. I will decrease intensity of the work. Definitely we need to work on your posture a little bit. Yeah. Well, it's gonna be. I'm actually going at least inching. Yeah. Okay. Definitely have a lot of inflammation.
It's what, liver on that side?
The liver is usually more right in the middle. Yeah, but your intestines are not a little bit. Go up. Yep.
Yeah, that's pretty much gone on my mid back. But it's I can kind of feel the hips are a little bit tight, but
okay, let's do twisting left and on the back. So we worked on the back.
Right.
So think about this way. We released the tight area. We did not release your hip. So your brain starts to recognize this is loose and start to comparing. It's not your pain is traveling, it's just you're more comparing loose to tight.
Right.
That's a very good sign that we lose one area. So where are your tightness now?
Just yeah, I can't really tell at all in the back.
Okay. And the back is fine. Okay. Definitely need some work on your hip. Yep. So let's see how it feels.
Yeah, I could definitely go a lot farther.
You turn it more. Yep.
My range of motion is definitely better.
Extend. That's gonna help you with golfing a lot. Okay. Spin forward and extend. Okay, let's do 5 down.
What's that?
5 going down.
Okay.
Go up. And just back and forth quickly. Good. How's that feel?
It's much better.
Yep.
Yeah, before I could only get to here and it was so tight. Now I can touch
the floor. Okay, you can see the floor now.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.